Hi, this is Dr. Steele. Today I want to talk to you about a subject that is extremely important. As we get older, and if we have diabetes, hypertension, or hypercholesterolemia, which is high cholesterol, we are more at risk of having heart attacks. So it's important to recognize those signs and symptoms that we can have if we have a heart attack. And it's important to recognize that it's important for you not to go to the urgent care centers. If you have the following symptoms, please go to the ER, go to the main hospital, because we want you to be evaluated by a ER doctor. At that moment, we need somebody skilled to identify those symptoms, and I'm going to tell you why in a minute. So the main symptoms, and I'm going to just give you a few, but if you have diabetes, I'm going to give you another symptom that sometimes we overlook as physicians, as doctors. So remember, if you have any chest discomfort or anything related to pain, especially if you feel someone on top of you, like you feel like somebody standing on your chest, pressure like pain, it's important to recognize that symptom. But remember, that's the typical symptom, and diabetics don't get those symptoms sometimes, and I'm going to mention that in a minute. But it's important to recognize that that sensation is never accompanied by itself. If you have other symptoms, and sometimes a heart attack can make you feel like you have some type of reflux or gastritis or some type of abdominal symptom, and sometimes that's because the heart, just like the stomach, is connected by the vagus nerve. So you may have nausea, wanting to vomit, you may have some reflux, some uncomfortable belly thing and belly discomfort, and sometimes that's why we miss it, because we think it's in a stomach issue, but it's not. It's a heart attack. So if you have chest tightness per se, and you have nausea, vomiting, if you feel clammy, sweaty, something's off. If you're nauseous, if you feel like you want to vomit, and you feel a combination of signs and symptoms, not only one symptom as far as the heart attack goes. Also, if you have any issues with feeling lightheaded, could be a heart attack. But again, it's not by itself a combination of symptoms. Now, more telling if you have neck pain, maybe arm pain, especially on the left side. If you have back pain, could be a heart attack as well if you tied all those symptoms together. And also, if you have discomfort in your shoulder, as I mentioned before, especially the left side, not always, but more commonly, it could be a heart attack. But the one that diabetics have sometimes is not even those symptoms, which are typical for somebody having a heart attack. The main one is shortness of breath. If you have shortness of breath and you cannot speak in full sentences, something's off. That means you need to go to the ER. And people say, well, I'm going to wait until Monday. You're not going to make it. It's important for you to get evaluated, okay, right away. Another one that I've seen many of my patients have is feeling anxious. They don't know why, but they feel something's off. And not necessarily they feel the typical signs and symptoms like chest pain, nausea, vomiting, shortness of breath, whatever. They don't feel that. They feel just very anxious. And that's what I mean, because I had a patient, one of them of many, that they went to the urgent care center and they thought it was just gastritis or anxiety, but it wasn't. It was a heart attack. And unfortunately, that patient didn't make it. Went home and he passed out at home, even though he went to urgent care. So I'm not saying every urgent care is going to miss this, but I do want you to be evaluated by a, experienced doctor, physician, ER doctor, because sometimes as we get older, sometimes we want to go to a small clinic when sometimes they're not equipped or they don't have the staff that is knowledgeable enough for them to identify those signs and symptoms. That's my talk for today. Take care of yourself. Remember, the greatest wealth is health. Talk to you soon.